Thank you, Rachel, for turning us on live. As we do each week before we start our webinars, we just hold fire as all of the registered participants join in. So we'll just wait a couple of minutes and then we'll get started on this week's presentation, which we're very fortunate to have Wendy Sullivan with us to talk to us all about first aid for cruising. But we'll just wait. We'll let the numbers, the ticker roll over there, which it's doing, and then we'll get started. Where are you today, Wendy?
I'm in sunny Gold Coast of East Coast of Australia.
Fantastic. And it has been good weather there, yeah? You're already getting some spring?
It's fantastic. It's almost like summer today. It's quite incredible, actually.
Excellent. Okay, so we'll keep moving. So welcome to all of those people who've joined us for today's webinar. Another one in the series that we've been presenting since the start of COVID back in April. Multihull Solutions. We've been covering a broad range of topics. And this one here is obviously something that people have been waiting for because we've had quite a number of people registered to watch today's presentation by Wendy to discuss first aid for cruising. And what we'll just do while we're waiting for people to join us, we'll just also just mention what the next webinars that are coming up. In 2 weeks' time, another one that a lot of people have registered for is an introduction to cruising the Greek islands, the Eastern Aegean and the coast of Turkey. So that's on the 11th of September. And then we've also got 2 weeks after that, sailing Indonesia on the 25th of September at 2 p.m. And then 2 weeks following that, we'll be doing a live walkthrough of the new, of the Iliad 50. So this is another one of the new builds. We already have a couple of Iliad 50s have been built, but this one is on a ship as we speak, on its way from the factory. And once that lands in Australia, we're going to do a walkthrough of that Iliad 50, which will be very exciting. And then 2 weeks after that, cruising resources, which will be on the 23rd of October. So you can find all the information about those events on our website. And as most people do, they then register. And if you want to go back and watch any of the previous webinars, you can do that by going to our website, or you can go to our YouTube channel. So just type in Multihull Solutions on YouTube and you'll find a playlist there of all our webinars, which have been getting some very good viewing numbers, which is great. So as we do each week, we'll just explain. We welcome any questions as we talk through today's webinar. If you have questions, just go to your Q&A button, type the question, and then we will either endeavour to answer that as we go, or we may decide to just hold it over to the Q&A session at the end, depending on whether it's a question that fits with the section of the presentation that Wendy's covering. So just type your questions in Q&A. We welcome all comments, and it certainly makes the webinars more impressive when we're getting questions and interaction from you, the viewers. So ticking along, just be patient with me there. I'm just asking the slide. So myself, Greg Boller, as many of you probably already know, I'm the new yacht sales manager, and I've been hosting these webinars throughout. And in the background is Rachel Crook, our marketing manager, who sets up the presentations and controls things from behind. So we both welcome you again to this week's webinar. And now, the star of today is Wendy Sullivan, who, what I might do is I'm going to hand back control to you, Wendy, of the screen, and I'll let you just have a chat about yourself and how it is that you've become a first aid specialist. So welcome.
Thanks, Greg. Thanks, Greg, for having me, and to Rachel and for Multihull Solutions. And welcome everyone who's watching with us today. I'm aware that we have an international cohort with us today. Everything that I'm going to be covering is, of course, general in nature, and I think we can all agree that We're all from different backgrounds, from different countries in the world. And what we're going to be discussing will not replace a proper and registered first aid training course. So we're going to keep our information general in nature. And on that point, just a little bit about myself. At the moment, I'm a senior first aid trainer on the Gold Coast of Australia with Accident Emergency. We have 2 locations in Varsity Lakes and Coomera. I've been doing this emergency rescue training for the last 8 years. We train everyone from people who work in childcare. Yesterday, I trained someone from a helicopter winch crew, a person who does air traffic control at the Gold Coast airport. So a good cohort of people. We also specialize going out to super yachts and training their crew on lots of emergency drills and first aid procedures that they might encounter, and also how to use the equipment that they've got and how to be effective operators in case of an emergency. So my qualifications are, I have a Master Class 5 ship captain in Australia that allows me to skipper and captain commercial vessels up to a certain size and area. I also have my MED3 marine engine driver's certificate as well. And that sort of came about, I started to learn how to sail back in Canada, which is where I'm from originally. I ended up moving to Australia and I got a job on a boat on Whitsundays. And I've been quite experienced as a crew member, and we were sailing on a 75-foot catch in the Whitsundays with about 14 crew on board when our skipper was stung by an Irukandji jellyfish. He was quite incapacitated, and he became unable to control the vessel. So I, being the only next person who was able to do that, immediately took control of the vessel and the 14 passengers to get us back to the marina. We established that there was actually a doctor on board. He was from Germany and was not familiar with Irukandji. So I very quickly got the oxygen equipment set up. I handed him a first aid textbook and I gave him a quick rundown on what Irukandji jellyfish is, how it affects the body, and the first aid that we can provide. And I kind of left him to it. I was able to get the vessel successfully back to shore, and that's when I got a real passion for becoming a skipper. And it sort of went from there. On a personal note, my husband and I just came back from cruising the Whitsundays last month. We took our 2 daughters, who are 6 and 4, and we took them sailing around the Whitsundays, which is one of our favorite places to cruise. So there's that family focus as well. We were thinking about what sort of things could we encounter as far as first aid related, how could we keep the kids safe on board the vessel, and what sort of equipment would be smart to bring with us, maybe a few extra things pertinent, particular to kids when you've got them on board. And then we also have my husband's family. He's from France, and his family owns a yacht, and they cruise around the waters of Normandy. So they're retired cruisers. So again, there's a different focus on their needs and abilities and what they take with them and what sort of things that they might anticipate. So through my qualifications, I'm trained in marine first aid, tactical high threat first aid, stop the bleed, remote area first aid, advanced first aid, advanced resus, mental health first aid. So I clearly have a passion in what I do, and I'm really happy to be here so I can share my information with you as far as first aid information, but also to marry it up with the cruising yachts person, because that's my real passion. My husband and I consider ourselves land-based sailors, because I think you'll agree, once you're a sailor, you're always a sailor. So I'm also working towards my qualifications in paramedicine as well. I've also been fortunate enough to resuscitate one of my students in one of my first aid training courses. So it's not just a matter of theory-based training. I've also had to implement what I know, and under high-stress environments. So what I want to iterate today is that I've done lots of sailing, and almost nothing has ever gone wrong. So we don't want to put you in a heightened sense of awareness with what we're just going to discuss today, but it's more of a just being prepared. So as we know in sailing, you plan for the best and you prepare for the worst. So worst case scenario, are you going to be prepared for what you're going to encounter? And that's really what this is about today. So things that you might want to consider before you go cruising is your pre-trip planning. Now, all sailors know that there's a lot of things that we have to prepare for, lots of checklists. Unfortunately, what tends to be forgotten, or people think, oh, we've got that first aid kit, we haven't checked it in a while, should be good enough. But we really want to put our first aid equipment at the forefront of our minds, knowing also that technology has been rapidly advancing and there's so much great equipment available, and it just keeps getting better and better. It is now designed for the marine environment, and it's more lightweight, waterproof, and you really want to think about having it in an area that you can easily reach. So we've all got a grab bag on boats in an area where you can access it quickly. If you have life rafts on your vessel, definitely having a first aid kit in there as well, or making sure that that grab bag is within reach. So,
Hey, Wendy,
yes.
just while you're there, just going back a step, we had a really good question just come through while the qualifications that you acquired, you've done all of those qualifications and acquired all of those here in Australia?
That's correct, yes.
Yes, okay, cool. There was just a question there about that. That's great, thank you.
Yes, no problem. To add to that, I also have my Yacht Master certificate as well, but that is the Australian Yacht Master, not the Royal Yacht Master. So things vary from country to country. So I am commercially qualified, but then that would be different things in different countries. Yeah.
Understood. Yeah. Thanks for the question, David.
No problem. So when we're thinking about equipment, some of you may be doctors, some of you might be nurses, some of you might even be paramedics, some of you may never even have taken a first aid course before. So when you think about what equipment you're going to be taking, there's so many factors that come into that without overthinking it too much. When I train crews on super yachts, they have quite comprehensive and advanced first aid medical kits where they can do quite comprehensive medical procedures quite far offshore. That might not be your focus. You might be going to an area where you don't need a lot of equipment, and you might be concerned about carrying things that you're not qualified to use, which is definitely something you should consider. But also something to think about the area that you're cruising, and thinking about maybe talking to a travel doctor. Do you need certain vaccinations or shots before you go? Do you need malarial tablets? These are things that you can add to your first aid kit, which will be dependent on where you're going. But ultimately, that's a personal conversation between you and your doctor. With us taking children on board, we were mindful of bringing the medication that we might need in case the children became sick or unwell. We're all pretty familiar with seasickness, and definitely getting on top of, firstly, avoiding it if you can, and also treating it if and when it does occur. And the best person to talk to about that would definitely be your medical professional, because there are a different range of things available. So a bit of equipment that you could take is what we've got on screen. Is we've got what's now called a modular first aid kit. So first aid equipment has advanced to the point where they're pretty much equipping first aid kits in the way that paramedics set out their kits. So they're pretty lightweight grab bag style, and this is the one I've got here. It's the one that you've got pictured. And we recently went bushwalking, so we put the anchor down, went onto Whitehaven Beach, and we went bushwalking. And just in the backpack, we put in our snakebite modular kit. So in this first aid kit, you've got all these little modules. So you only really grab what you need, because what we find is someone who's not quite experienced with first aid, what they'll tend to do is they'll open up their first aid kit, even if it's just a cut or a scrape, and they'll start to rummage around, and they don't really know necessarily what they're looking for. So if you know like which module to grab, then you can just really take from that module what you actually need. So for a bushwalk in Australia, we're always on the lookout for the potential for a snake bite. So we just threw our snake bite module in our first aid kit, just in case we needed it, to keep ourselves lightweight on our bushwalk, but also prepared as well. And just thinking about your handheld VHF radio when you're going bushwalking as another form of emergency rescue equipment, that we think of it that way. If we need help, we can radio to someone else. So we include that in equipment as well. Something else that has definitely changed in the last few years is the availability, the cost, and the durability of defibrillators. And the one I'm holding up here, and what you can see pictured, is the heart sign defibrillator. So this one has one of the highest IPX ratings on the market, which means it's incredibly rugged. You can fire hose this unit for 3 minutes straight, and it keeps on going. Now, when you consider about why you might want to take a defib, if someone goes into cardiac arrest, we have a few moments within minutes to get a defibrillator on their chest after we start CPR. So it's all about planning ahead and thinking about, if we are in a remote area, can we hold our own until support gets to where we are. So thinking about carrying a defibrillator, and just to give you an idea, in Australian dollars, this defibrillator with the package that you can see on the screen with the waterproof tough case, the signage, and a prep kit costs $1,849. So if you think about purchasing an EPIRB, a handheld VHF, some people probably won't think too much of the cost of that. And you can think of the same way as a defib. They're now becoming just part of required equipment and vital equipment on board, especially when you're going offshore. When you are remote, it just buys you time, as you can convert that heart rhythm back into an effective rhythm before help arrives. And you can see it's quite lightweight, it's 1.1 kilos, so a really good option. We definitely go sailing with our defib. We have one, a personal one that I carry in my car, and I know not everyone does that, but part of it was so that when we do go cruising, we could have a good quality first aid kit and our defib with us as well.
And Wendy, that's one of the models where the device actually talks to you, yeah?
Yeah, it does, and I can demonstrate. This is actually a
training scenario. 1. Adult patient. Call for medical assistance.
And you can get them in many different languages. They're a little coach. You don't need a lot of a skill set background or experience to know how to use these quite well. This is a training version of the one that I also carry. And we are selling quite a few of these. Even caravanners are really interested in this model, because they just feel more confident having them in their caravan, in their car, and cruising sailors as well. Interestingly enough, and I'm not sure if many people are aware of this, but defibrillators are not legislated in Australia, except for vessels, commercial vessels who carry scuba divers and snorkelers. They are actually legislated to carry defibs on board, so that if there is a drowning event or a cardiac arrest due to the remote area, then they can properly and effectively resuscitate those patients. So that's an interesting development, but it probably won't be long before these become more and more required. And those of you who are joining us from overseas, you're going to have different regulations, and they are found worldwide, but we really want to have one close at hand if possible.
And on the picture there, the blue picture where you've got the green AED sticker and the defib, what's the black package just underneath the green sticker?
So that's a patient preparation kit. So it includes an airway face shield, so you can actually give mouth to mouth, and it includes a one-way valve. So it's really the gold standard at the first aid level for ventilation. So the 30 compressions and 2 breaths. It also includes a razor, so you can shave any excess body hair from the patient, because without that, it could impede the shot going into the patient's heart. It also has a little towelette to dry down a wet patient. We know people, when they go into cardiac arrest or, of course, drown, they become quite moist. So we want to make that area, expose it with scissors, which is in the kit as well, shave down, and also dry off before you apply the pads. I've trained people who are deaf or hard of hearing, and this particular design, because it has the flashing lights, those students find it incredibly effective, because they can just look at the pictures and it just helps them with their response. And again, if you're not as confident as some people, the machine and the equipment is really now designed to talk you through all that. So it really takes a bit of the guesswork out of it. So modern technology and modern equipment is really the way to go. And I'd really invite you to have a look at your first aid kit. Every time I get onto a boat, I always look at, of course we always look at the equipment, but we certainly go through the first aid kit, and oftentimes you'll find that it's been checked and then left but not updated, and it's old and it's inadequate. Another thing that we have to consider is who's on board, who like I said, some of you might be medics or doctors, so you're probably going to take different things than a first aider would. And you want to think about who's the best person to give this medical treatment, who's going to be the medic when you are cruising. And not to overthink this too much, but just have a bit of a crew meeting and decide what's the skill set of the people that you're sailing with. We highly recommend that all on board get first aid training, because if your medic goes down, who's going to look after that person? And it'll just give the crew confidence, and you could even possibly run through some first aid drills. So it just gives you that more confidence that you can work well and cohesively as a team if and when things were to go wrong. And it could be simple things, or it could be quite high level things as well. So considering—
And Wendy, that's very important, because a lot of the clients who are purchasing the yachts and going cruising, a lot of it is just husband and wives. It's just the two packs on board.
Yeah.
So it's critical, isn't it, that both members of that, as you say, cohort, both members of both of those people have done a course. Definitely,
that's right. And we actually have a lot of couples come in because they want to be able to look after each other. So we definitely encourage that. It's not good enough if one person knows. It's just like driving the boat. Does do both people know how to drop the sails?
Yes.
The engine, do a man overboard drill? It sounds like basic stuff, but it's so important. So knowing how to look after each other really well is the most important thing for sure. Yeah. The other thing to consider is, where are you headed? You might be going from marina to marina, and you're in a safe, sheltered area where you might have a medical center just around the corner. But you might be going on the outer reef for a couple nights, and that's an amazing thing to do. So when you consider what to bring, you're thinking about where you're going as well, and how remote are you? How quickly are we going to get help if we need it? Those types of things. Just being self-sufficient.
And one other thing too, a lot of our clients are, are sailing across oceans, between country and country. And I think we talked about this the other night. I can't recall if you've got it on the next slide, but it's also making sure you've got all your documents for your medicines.
Definitely, that's right. And when it comes to medicines, it's kind of like, how long is a piece of string? You might take a lot of medication, or you might not need so much. And that's also knowing the people on board your vessel. Like you say, if it's only a few people, you'd know each other quite well, but you might have brought on a few extra hands and you might not know them so well. So really getting a medical history from them as far as appropriate. Do they have any heart conditions? Do they have diabetes? That type of thing.
Yes.
If something were to go wrong, how can I best help you? That type of thing. And just make sure you take extra stock of your medications, because we've all been in that situation where something's gotten wet, a hatch wasn't closed properly, and it always tends to be those medications or your extra pair of eyeglasses or that kind of thing.
Exactly.
I'm just going to flick over the next slide. So still a bit more on pre-trip planning. So we're talking about who's going to be the medic. Always good to, even if this is just within a couple, is thinking about who works best under pressure, who's probably the better person to deal with it. And knowing that if someone happens to break an arm, certain people are going to be able to feel more confident to deal with that. Some people be more confident in dealing with bleeding. So we always tell people it's okay not to feel all right with everything. There's things that are going to make you feel uncomfortable, but if you have good training behind you and good equipment to back you up, then you can usually get through most scenarios. And as we know, when things go wrong, it doesn't always go to plan. I've been on deliveries on the east coast of Australia where there were injuries. We needed an ice pack, and at that exact moment the ice machine failed to work, so we were rummaging through an esky, a cooler box, trying to get cool drinks just to put on this person's limb to as a makeshift ice pack. And I think that's what cruising sailors are pretty good at. We're quite experienced at just making do with what we've got, and that's really what it's all about. It's just, just knowing that, you're probably going to get a few cuts and scrapes along the way, but are you prepared to deal with them? And even the small things like coral cuts, we need to remember, particularly in the East Coast and certainly the northern tropical areas, that coral cuts need to be properly cleaned and dressed. So you want to think about getting a good wound care equipment, antibacterial equipment, that type of thing, and just knowing how to properly dress those wounds. So it's not just good first aid at the beginning, but good aftercare as well if you're not going to be in port for maybe a few days. I've heard many stories of things such as barracudas biting fingers off to, all sorts of things. And I certainly don't anticipate that you'd come across that type of thing, but just always good to be prepared.
I concur with that. From many years of living and working in the Whitsundays and in the marine industry, I think betadine was my best friend.
Yes, that's right. And now that's sort of becoming, we're moving past betadine as well.
Yes.
So yeah, so just knowing it's been great stuff for a lot of people. So just knowing what, a lot of first aid, when people come, they say, oh, it changes every time. And it's usually based on evidence-based medicine. We're getting better, we're getting smarter, we know more things now. And that's really, if it does change, that's usually why it does change. And just things, if you're going into different locations, the medications are going to have different names than what you're used to at home. I've encountered that myself going into a pharmacy in Bali and trying to ask for something, but needing to know what I'm actually needing in the local, not so much language, but what they actually call it, the local branding, I should say.
Yes.
Knowing that certain countries you can actually buy EpiPens in certain countries. So if your family members require EpiPens for anaphylactic reactions, then probably best to stock up while you're in your home country, just in case. And also we know that temperatures can vary on boats, so making sure that medication is stored appropriately. Of course, if you have children, making sure that it's, of course, stored appropriately as well. And watching out, so if you're you are cruising as a couple and you notice that your partner's not feeling well, being proactive and really getting some information about what's going on with them. It might be nothing, or maybe it's the start of them becoming unwell, and just the trick is to getting on top of it quickly. And on that note, we want to think about if there is something going on. It might be an illness or it could be a medical emergency. Are you confident knowing who to contact in an emergency? So speaking from an Australian standpoint, for marine emergencies, we're definitely going to call 000. If we don't have immediate service for our mobile phone, we're going to use our sat phone. We can use our VHS radio. We can call a pan-pan if that's to the point where we need to put out a pan-pan call to other vessels. We also have the Coast Guard in Australia, as do many other countries, and we have volunteer marine rescue. And just remembering to check in if that's something that you've chosen to do, just for that extra value of safety. So I'll just put that up there for you. So a pan-pan is possible if you know how to do it, and if you're cruising sailor, you most likely do, but knowing when to use the pan-pan and the mayday and what the difference is between the two of those. So just to give you an example, the director of the company that I work for, First Aid Accident Emergency, tomorrow he's actually going to Southport Yacht Club, and he is making a training course for cruising sailors. So they've asked him to come out and do a first aid course, but what we do is we tailor it to the audience that we have. So if I was with you in one room, I would be tailoring our first aid training course to your specific needs for cruising sailors, and that's really what we're best at. We can just tailor our training to our audience, and because I have this background as a sailor, it's something I'm really passionate about, and I can just add that extra value, which is quite exciting.
Very good.
So yeah, we really are all about getting good training, and in your home country, whether you're in Australia, it could be as basic as doing a first aid course, entry level, CPR training for sure. You can go all the way up to advanced first aid, becoming a medic if that's something that you choose to do, or you might already have that medical background as well. The thing to remember is that I've met many medical professionals that are not confident in first aid. because that might not be their skill set or their specialty. So even if you do work in medicine, always good to keep your skills refreshed. And there's always going to be certain things that you might be unfamiliar with depending on where you're going. So just knowing what each crew role is and having some emergency procedures laid out just in case, just like you would for the unlikely event of a man overboard. We want to make sure that everyone knows what to do. Same thing with first aid. It's an unlikely event, but we're going to prepare for it just in case. What we find with our participants in our training courses is it's mostly they come for the confidence, the peace of mind, just knowing that if something were to go wrong, and we know that it doesn't usually, do you have that confidence to step forward, and do you have the equipment that you need to make a difference and to be an effective operator in an environment where you may or may not be remote, and you most certainly need to be self-sufficient, and knowing how to get help when you need it. So, you know, putting a call out to other boats who might be available to give you a hand is really important as well.
And Wendy, that again comes back to the fact that a lot of the clients or people who are tuning in for today's webinar are people who are planning to go and sail in the Mediterranean or sail in the Caribbean and so on. And for a lot of them, one of the first things you do when you go into a new cruising country is you use local knowledge. So you talk to the other boats, you talk to people on shore. And a lot of people do that about where to go and where to anchor. But it's also a good thing to also pick the local knowledge in terms of where medical assistance is, what numbers to call, what hazards are present in that area. So it's that from a medical standpoint, use the same local knowledge approach.
Definitely, absolutely. And which brings us to our next point is potential dangers that you might encounter in the area that you're cruising. So like you say, it could be the Mediterranean, it could be anywhere in the world. And just doing some research, just like you would when you're catching fish. Do you know which fish are safe to eat, which are not safe to eat, and what you can do with that? So most people are aware that Australia has particular creatures that need to be best avoided in some cases, and if you do encounter them, there's particular first aid techniques that we do provide. So marine creatures is one of the big ones. Of course, we're sailing in a marine environment. Having said that, again, snorkeling, swimming, I also have my my dive certificate as well, so I love going scuba diving. And I have to say that, again, I've done a lot of sailing professionally as well as recreationally, and again, knock on wood, I haven't really encountered many things. I just like to be prepared. But one really important piece of equipment, I had it pictured earlier, is a good quality tourniquet. So knowing how to stop life-threatening bleeding in the unlikely event that you do encounter one of your passengers or crew with a massive bleed, that's one of the most important ways that you can save life if you understand how to apply a tourniquet, and you can do it really quickly. Knowing where to apply it, how quickly it needs to be applied, how to do it properly, and what to look for is particularly vital. The east coast of Australia, we've had some incidents in the past, and really, you know, good effective equipment and good training can make a huge difference to the outcome of the patient. So that's something that we're quite proactive in our training courses, following all the Australian resuscitation guidelines on these techniques. Knowing how to apply a tourniquet can definitely make the difference between life or death. So that's one thing that I definitely do carry with me in my my first aid kit. And that's the thing, you can add anything extra that you choose to. So marine creatures are something you need to know. What is the treatment? In Australia, we have a few treatments. The big ones are pressure bandages for certain creatures. Or we have applying vinegar to it, or hot water treatment, or ice. So those are the four most common treatments for the majority of creatures that we might encounter. It's just knowing how and when to apply all that, and knowing, do I need to carry vinegar on my boat, or am I not in that cruising area, that type of thing. And knowing how emergent it is to get your patient to definitive medical treatment if and when you have encountered this marine creature.
And that brings me to, remember, we talked about it last week. It's that also the ability to know how to improvise to get that resource. I was saying about the time I stood my foot on a sea urchin, and the only way I could get hot water was through the water outlet on the outboard engine.
Yeah, exactly right. And that's, again, I think what cruising sailors are good at. We're really good at making do with what we've got. And myself, I've done the same. You just sort of, you think it through and think, okay, we have a situation, how are we going to best deal with it? And something we mentioned earlier, you know, if a burn were to happen on board, this is a really good burns module that comes in this Modular First Aid Kit. And just to give you an idea, this kit, we've got it on sale for $159. So it's a level 4 kit. So it's a quite high level kit, but quite affordable. So I purchased one for myself and for our boat. But inside it, you have burns sachets. So you've got burns gels. And not every boat that we're going to be on will have a water maker. So we have to really be mindful of conserving water in certain circumstances. I've come across that many times where we needed a fair bit of fresh, clean water, but we had to really make do with what we had, and we had to be quite smart about it. So if you do encounter a burn on boat, we really want to make sure that we can put a burns gel on it, because you can put these on your wound for about 15 minutes and it covers and cools, instead of you putting fresh, clean running water on it for up to 20 minutes, which can really deplete your vessel's water stores, depending on the type of vessel that you are on. So there's just being smart about it and knowing where you might be going and what you might need. And also the native flora that you could encounter as well, knowing what's safe, what's unsafe. But like you said, Greg, it's just talking to locals, and when you're doing your research about all the wonderful things you can see, it's just also having a chat about, you know, is there anything that we need to know about that might be dangerous as well. Yeah.
Very good.
So just moving on to some common issues on board. Again, we could be here for days and weeks talking about all the different things that could occur. And again, we're going to state that it's unlikely, but we're just here to help you to be mindful about being prepared, getting good training and good quality equipment. So we've got medical emergencies, heart conditions, cardiac arrest is something that could occur. Do you know how to do CPR, and can you do it effectively? Do you have a place on your vessel, if needed, where you can operate effectively and have the room to work and maneuver that you need to? Just things to be considered of this. Something I always consider when I'm helming the vessel, I would just look around and think, if something were to go wrong, and this is in a professional capacity, what would I do and where would I do it is something that I do consider.
And we sell multi-hulls, and it's a great thing about multi-hulls is you do have, you know, having sailed monohulls and multis, there's so much more working space, isn't there, on the deck of a multi-hull catamaran than there is on a monohull.
Absolutely. So you're really going to work to your advantages and use that additional space to your advantage for sure, definitely. And just diabetic emergencies, you know, do you know someone who has diabetes, and making sure that if they have medication, do they have it? And also, do you know how to administer it if that's appropriate? Hypothermia is something that's potential to come up, certainly with exposure. If you have a man overboard and they've been in the water for a while, do you know how to deal with it appropriately? Do you have your equipment, such as your emergency blanket? And what sort of things could we use in the interim, such as blankets or just body warmth and that type of thing? So just being aware and confident, because that's something that's particular to the marine environment. Dehydration as well, that could happen just on night watch in the hot sun, or of course just during seasickness where someone's vomiting to the point where they do become dehydrated. Do we know how to deal with it? Other things that could happen, again, unlikely, but accidents and trauma could occur, and that's where we're thinking about our bleeding control, broken bones and that type of thing. It might be to the point where someone has a slip and fall, and your only option is to turn the vessel around and get back to shore while keeping them as stable as you can, especially if you are a couple. So knowing how to keep them comfortable. And one of the jobs I've done in the past was actually doing vessel handling training for couples. So to making sure that both parties of the couple were comfortable to maneuver the vessel if needed in an emergency to get themselves and their vessel back to safety. So I'd invite you to consider, are you comfortable enough to do that not just relying on your partner to get it done when needed. Rope burns is something that could come up. Some of us wear gloves and that's not a problem. So I always prefer prevention over cure, but sometimes it does happen. You know how to deal with those. So the average person wouldn't have to think about those, but it can potentially happen on vessels. Pinch point injuries. Winches, I've worked on massive winches or small winches and just keeping fingers back and away, but occasionally it does occur. Just even on hatches and lockers, it's just little things like that. Do we know what to do? Burns, like I said, on vessels, probably going to happen on the galley, maybe on a hot engine, that type of thing. So instead of, you know, pouring all your precious water down the sink, think about getting good quality burns dressings instead. Bleeding control, definitely a big one. I would recommend a tourniquet for your first aid kit, absolutely, regardless of where you're sailing, and definitely know how to use one. When appropriate, they can make the difference between life or death. And on the smaller end of the spectrum, just making sure that, you know, if you have a wound, making sure that it's well cleaned, particularly if you're anticipating that you might be quite away or a while away from seeing a medical professional. Head and neck injuries, we could be going up the mast, someone's had a fall, they're on the deck, what do you do next? So again, good quality training could talk you through all of that. Drowning and immersion, the first thing is can and are you able to get them back on the vessel? This is something that we've encountered to be particularly difficult if you don't have several crew members. So just being aware of what to do and how to resuscitate if required, and definitely getting help if you have other people nearby is always a good thing. That's what we always recommend. If you have other people, encourage other people to give you a hand if and when that's appropriate. Stings and bites, that goes back to the local area that you're visiting and knowing what you might encounter and how to treat them effectively. Coral cuts, really good chance of infection, so we want to make sure that we know how to keep those nice and clean. A lot of people say, oh, it's just a little cut, but have a good look at it. Is there any coral in it, and have you thoroughly cleaned it, disinfected it, and covered it up appropriately? This is something that can really put a dent in your cruising happiness if you get an infection, so it's quite unpleasant. So again, asking your doctor or your travel doctor what medication they recommend that you take with you just in case. Fish hooks, again, this might be a very simple procedure or it could be a very complex procedure. Working with many commercial fishermen, you know.
A very painful procedure.
Very painful as well. You know, it could be any part of the body, certainly. So you wouldn't attempt to touch it, and some might just be happy to remove it as well. But then thinking, have you had a tetanus injection? All of those types of things and considerations. And which brings us down to the end, really, and what I've been saying throughout is really just good quality training. It's just before you go, making sure that so a lot of you probably do have training in the past, but just making sure that it does stay updated as well. So what sort of courses? At a bare minimum, absolutely do a first aid course, not just for cruising, but for your general day-to-day life. You can never go wrong with good quality first aid training. And really, when you're thinking about choosing a training provider, we really specialize in hands-on, getting people getting in there and really having a go with the equipment so they're comfortable using the defibrillators, working on the mannequins, bandaging people up. So it's not your first time if you are faced with having to provide first aid. CPR, in Australia, it's recommended that we update CPR every 12 months. So that's a minimum. I think if you can at least update your CPR skills every 12 months, and that gives you a good base of skills and knowledge to work with if and when needed.
And it's we talked about this the other day, Wendy. I think many of us, as we get older, through our careers or through our whether it be recreational or professional, we've done first aid courses, and we go, oh yeah, we've done first aid. But this time, if you're about to set off and go cruising, if you're going across the ocean or wherever, it's actually really worth going back. And even if you think you've done first aid, go back and do it again, because this time it's actually really important. You know, a lot of people are ticking that box. Oh, I've done my first aid course. That's one thing they said I had to do. But this is actually not for that reason, is it?
Yeah, exactly right. And it's all about the provider who you choose. You know, you don't want to sit there and tick a box, and you know, you can read anything yourself out of a first aid textbook, but you really want to have that hands-on experience. That's what you're there for. You want that muscle memory. You want to play,
Yes.
use the equipment. So be quite discerning in the first aid provider that you choose, because it can make all the difference. So I myself, and we have to do all our first aid training, we have to keep it up to date as well, and we're quite particular in who we choose, because we learn things all the time. So it's not just ticking a box, it's thinking about getting information to help your friends, your family. So it's very vital information.
And I know Rachel asked you the other day, oh, are you going to, with COVID and everything, are you going to do online courses? And I think your response was very apt, and that was, you know what, it's not as good as a practical in the classroom to get a training experience.
That's true. We're mindful. We think there's always a good reason to train, and in particular, this is a complex environment, and we have really adjusted our training and done a lot of risk assessment on how to keep our participants and trainers safe during COVID. So we do practice social distancing when we train, but it's just you still get to work on a mannequin, you still get to use a defibrillator. It's just that you're socially distanced, and we disinfect everything once we're done. So we've been really mindful on how to adopt and adjust our training without taking away from that experience that the participants really, well, that's what they come for, is high quality training and just getting that hands-on experience. Yeah.
You know, everything from wrapping a wound to learning how to wrap bandages and all that practical experience.
Yeah, you really have to do it. You have to get in there and have a go, because you don't want to be putting your first bandage on someone who's bleeding, they're injured, you know, it's the middle of the night, if you've gone for a night cruise and the weather's a bit up, you know, that's certainly not when you want to be doing it. So just, come and get some confidence, have some fun. We actually have a lot of fun. We love what we do. People come to us because we do have fun. It's a balance of getting the information that you need in a comfortable and fun environment, and just doing lots of scenario-based training. And we encourage people to go back on their boat and do some scenarios, even just within couples, and just go, okay, hon, if this were to happen, what would you do? Just that kind of thing. So, you know, you can walk away with your head held high thinking, yeah, I've got this. Yeah, I'm pretty confident that I can at least work my way through it. And if not, I know who to call to get good quality advice, or also medical evac. That's just really what it's all about. So, potentially you could go all the way up and do advanced resuscitation, advanced first aid, and that's really a personal choice on yours. So if you are doing, an Atlantic crossing, you probably want to get a higher level of skill set and training versus more casual cruising. So that's really a personal choice on what you choose to do. In Australia, like I said, we offer our training courses on the Gold Coast in Varsity Lakes and Coomera, but there are many great training organisations all over Australia and all over the world as well. So definitely encourage you to investigate and read some reviews, ask some friends what they consider to be good quality training. You could probably seek out a marine first aid course as well. Those are available. So really try to get a course that is geared towards what you're looking for, so that they can speak to you when you're training and tailor it to what you might experience. And you can probably start to look in your local yacht clubs. They might have some information on something that's appropriate. So just to finish off, I just wanted to say thank you so much for listening. I hope I've shared a few things that you find helpful. And again, I thank Rachel and Greg from Multihull for having me here today. So I'm Wendy from First Aid Accident Emergency, and I wish you a safe and healthy cruising time throughout. But if you do need any assistance, I do hope that you feel confident that you could apply your skills and knowledge if needed. So thank you so much for listening. I appreciate it.
Wendy, we are going to just have a quick Q&A session.
Right.
One of the first questions, first of all, thank you very much. I know it's quite hard when someone says, can you come and do a first aid presentation, because as you mentioned, how long is a piece of string? But the underlying message that you're giving is, don't go out there and do what you're going to do unless you've gone and done some training and are confident and happy that all those aboard can help each other in a medical emergency. So I think the message is clear. One question David has asked, do you have the price on the Tourniquet?
Tourniquets, they vary in price. Can I ask where he's located?
David's on the Sunshine Coast, I'm pretty sure.
Okay. Dave, I will say that you should be spending at least $50 and make sure that you're getting an authentic tourniquet. That's my best advice. There are many suppliers online. I would start with the CAT tourniquet, C-A-T. The CAT tourniquet Generation 2 is one of the best on the market, and you should expect to pay at least $50 if you're getting the authentic tourniquet.
And ladies and gentlemen who are with us today, if there's any other questions, we'd welcome those. So we'll just hang about here for a minute or two and see if there's any more questions.
On that note, I am just going to show one more slide, and it's just for further reading and information. It's something that I take on board with me. Is there's two examples on the slides. First Aid at Sea is a good reference, and also the Skipper's Medical Emergency Handbook. It's just something to keep in your first aid kit or in your library as a good reference in case you encounter something that you're not familiar with. So you can just look it up and use it as a guide. And also, we were talking the other day about a fish reference as well, a good reference on the fish that you might encounter. And we've got it up there under Grant's Guide to Fishes. And I'm assuming that's an Australian book.
That is, it's a Pacific, a South Pacific focused book, but I'm sure in other areas there are equivalents. But I remember growing up and sailing, it's just a resource you have to have on board.
Yeah, excellent, fantastic. So yeah, just carrying what you need is the best way to go.
Oh, very good. And is that the last of your slides for today?
It is, yep.
Okay. Well, listen, I don't know. Maybe we've done such a good job today, Wendy, that everyone's satisfied with the information provided. But we don't have any other questions at this stage. Okay. So what we'll do is we'll just hang fire for a minute and see if anything comes in, and if not, we'll start wrapping up. And but yeah, that was very good. And we look forward to doing our next webinar in 2 weeks' time. So to all of the people who've joined us today, thank you very much. And Wendy, thank you. Very good, very concise. We just do have a question there. Which of the two books is best for the med? So of those two first aid books?
I would personally suggest the Skipper's Medical Emergency Handbook. It's been written on an international focus by two medical doctors, so it's definitely not Australian specific. You can go online and Google it and have a look through it, but I would definitely recommend that. It's a general view. It is not Australian specific at all, so that would be my recommendation, but I'm sure there's a lot of other resources out there as well, and that is an updated version as well, the second edition.
All right, and I think the final message for today is do your training, do your courses, and do your drills.
Definitely. Stay safe and happy sailing.
Yeah, and thank you. So we'll finish today's webinar there, and that was fantastic. We'll see everyone in 2 weeks' time.
Thanks, Greg.